There's $6 billion that's spent every year on non-emergency transportation, and yet still most hospitals have no-show rates, 20–50%.
3.6 million people are missing their appointments.
Discharge efficiency is awful. Patients get left stranded at their house or at the hospitals.
And on average, 25% or a quarter of the reasons that people do not make their medical appointment, it's because of transportation.
It's a really big issue, and we see that transportation is the most persistent barrier preventing patients from receiving the timely care that they need.
There's better alternatives out there, we know that today.
Did you know that the most flagged issue affecting hospital scores today is not the hospital food? No, that unsavory item actually falls behind complaints of transportation. And finding new ways to use disruptive solutions for transportation, already seen with Uber and Lyft, as a way to solve the problem of non-emergency transportation was a hot topic for healthcare experts at our NG Healthcare Payers Summit.
My name's Robin Heffernan. I'm the CEO for Circulation. It's a new startup. We've partnered with Uber to help patients get to and from their medical appointments.
I'm Anya Babbitt. I'm the founder and CEO of Split. We ended up choosing to form a relationship with Lyft.
We needed to create this layer between a health system and Uber rides that was HIPAA compliant. So we can take PHI, we can sign agreements with hospitals, but then ultimately flow anonymous rides to Uber.
And in addition to providing greater patient satisfaction, greater patient outcomes, are also saving the hospitals up to 35%.
Actually, whenever you divert a taxi ride to an Uber ride, it's at least 50% saving. Not to mention that patients now have on-demand options to take rides. They can get, to and from these appointments that otherwise they would have just no-showed.